Madam, liposuction surgery, how much time it will take basically?
Again, it depends on what areas are targeted. Suppose we're just doing one area, say gynecomastia, we do it in like 2 hours.
2 hours.
Yeah, I mean with the gland excision, just thighs. Again, if we're dealing only with outer thighs, inner thighs, everything, it all depends on how much areas and how much fat we are targeting to remove. It depends on that. And when we use technology, it's a little longer surgery because first we use one technology. Like for example, if I'm using Vaser, it almost doubles the time of surgery because I have to first do the Vasering where all the fat is emulsified. In the next step, I suction it out. It is better for the patient, but it's a little longer surgery. But I feel in plastic surgery, we don't really bother about the time. It's how well the surgery is done and what is the final result which actually matters. And obviously, we do try to keep the surgery as timing wise as less as possible, but the end result has to be good. And of course, a safe anesthesia technique is also important, which also we follow.
And what's the recovery timing?
Coming to recovery, if it's fewer areas or lesser area, they recover faster. The more number of areas, it takes a little longer. But most of the times, at least my intent for my surgery is they should be on their feet the next day. Able to use the washroom, basic things like eating their own food. They should not be dependent on anybody. That's what usually happens. But to get back to absolute normal, usually they take 4 or 5 days to 1 week. Like feeling also and all that.
1 to 7 days
maximum. But in that 1 week also, they're on their own. It's not like they're on bed rest and somebody is doing it for them. Not like that. But to feel good and not feel very tired and all that, it might take about 5 days to 1 week. That's all. Yes. So here you should understand that, yes, the result will show a bit, but there'll be swelling also. This is a very important thing that people should know. It takes, because second week we say is the peak swelling. Second week, the swelling is at its maximum, and then it will start coming down. By 1 month, about 50% of swelling goes away. By 3 months, 80 to 90. And up to 6 months, they'll keep looking better and better each passing by day. But they'll be back to their activity, everything in about a week or 2 weeks maximum. But the result will keep getting better and better with passing by time.
And after the surgery, will you recommend them to do some exercises?
Okay, so post-operative period is very important after liposuction. In fact, I spend a lot of time with my patients trying to explain to them what they have to do after I have done my job. So one is wearing a compression garment, which is a little uncomfortable, but they have to wear it for 4 to 6 weeks, depending on what we suggest, so that the swelling doesn't come up. And also it helps it is very convenient also for them, because wherever the fat is removed, it keeps it tucked in so that they're comfortable also. And also swelling won't come as much if they use the compression garment. That is one. Number 2 is lymphatic massages. It is something that we give a lot of importance to. It's not possible for everybody to go to a physiotherapist or somebody qualified person to get the massage, but we usually show the family how it is done, roughly. So they do follow it, and I've seen patients quite comfortable getting it done with family than going somewhere and getting it done. But if it is possible, even ultrasound massages, those are available with professionals. Ultrasound massages or manual massage, lymphatic massage, and compression garment. These things are must to recover well and to get the best possible result.
And any physical exercises do you recommend?
No. In fact, we tell them not to exercise for 4 weeks. But moving around in the house and being mobile is encouraged. Because they should not just lie in the bed because they have a surgery. A normal activity and moving around will help. After 2-3 weeks, depending on which site we have done the procedure, they are encouraged to even go for a walk outside. But hitting the gym or doing exercise like yoga and all that, definitely not before 4 weeks. And usually after their surgeon has advised them, has seen them and said, okay, now you're ready to go ahead and start your physical activity, then they can start.
It's a nice conversation, ma'am. So many things I have learned. Even I clear myself. I have a lot of doubts. Like I told you as before, I was thinking that if a fat person is there, they should go for liposuction. Well, not me. I think maximum persons.
Yes, that happens. That's a misconception, I should say.
Only.
I really, every time people, even if I don't operate, at least I educate that much and send them.
Yes, being a plastic surgeon or being a professional in my field, I'm the professional. In your field, you are the professional. You should educate. Like it's a kind of
Yes.
educate video only. So you have to educate
Yes,
the.
definitely. I feel it's a good initiative by you. People should know, what to do, what not to do,
Yes.
what to expect. All that is very important. Otherwise, sometimes they make wrong decisions. It might even, life is at stake if you make wrong decisions sometimes.
Yes. Will the results of liposuctions is permanent?
So, Bishwa, you should understand, yes, they're permanent. Again, maintenance is the key because fat is there everywhere in the body. Okay. So, somebody who finally comes to liposuction probably we are doing it for body contouring. So, he or she has to be disciplined and motivated to do that her bit to maintain the result.
Yes.
Suppose he came in with a weight of 70 kgs and we did the surgery. Obviously, he's in good shape now. After 5-6 years, whatever, if he's not following and he becomes 100 kgs, I'm just giving you an example. Obviously, if not in the same area, some other area, because fat is fat, it can be put on anywhere, right? But one important thing is that if we do in areas where it is awkwardly present, like saddlebags or even gynecomastia, exact same way it doesn't come back. Okay. Because it has healed by scarring or whatever. Okay. You understood, right? We remove that fat and it has healed there with the scar. So probably other areas which are not treated can get the fat. And let me tell you here, there's a very interesting thing that one or two patients came back, or even one or two friends of mine said this. They came and asked me, you know what we've heard is after liposuction, fat comes off in another area. Then I tell them, the problem is not with the surgery. Problem is with the person who does not keep the result, who's not motivated enough to maintain the result. Body, yes. That is why if it's all, again, a simple calculation. If your calorie intake is more than what you're burning, it has to convert into fat and go somewhere. Yes. Whether you've been treated with lipo or not, your fat will accumulate if you don't maintain it. Yes. It's simple logic, right? So they attribute it to surgery, which actually is like, how can they decide that surgery is at fault when the problem is with the person who's unable to, maintain it? So after anything, if you do in the life, you have to maintain it. Yeah, exactly. Then you'll get the result for the long run. Even muscle, somebody goes to the gym and builds good muscles. Forget about 6 months. 1 month, if he sits in the house, he'll start losing the muscle. This is also like that. But if they're motivated and they're having a healthy lifestyle, definitely it's a permanent result. No, there's no doubt about it.
Madam, before going to the liposuction surgery, is there any kind of instruction that you give to your patient that you should follow this kind of things before surgery? Okay, so considering that the patient is fit and now ready for surgery and we've given him a date, what we usually tell them is to be stress-free, eat healthy, and have good sleep, because all these will help in the healing. You understood. Somebody who's a smoker, definitely we tell them to stop smoking at least 10 days prior to surgery. And also we advise to stop all health supplements at least 10 days before surgery. 10 days before? Yes. Why? Like, sometimes all these supplements, whatever, they go through the liver, the metabolism, they can increase the chance of bleeding and all that. Mm-hmm. So all medications, except for some medication like thyroid and all, which are required, but general supplements we withhold at least 10 days before surgery. And people who are already on some medications for medical illness, so we understand what the problem is and then advise them accordingly. Okay. The rest is all general. They just have to have a peaceful time. They should, whatever, if they were doing exercise, they should continue to exercise till the day before surgery. Eat healthy, have good night's sleep, which will all help in the surgery. If a person suffering with type 2 diabetes, can he go for surgery? See, it's not a contraindication for surgery. We can. But again, health is the priority. Yes. Because this is an elective surgery, we make sure that the diabetes is under control. Okay. And there are no sequel. Like, diabetes can affect the whole body, right? So we do a lot of tests to make sure that general overall health is normal and good. Okay. For
him or her to undergo a safe surgery.
Okay.
Per se, diabetes is not a contraindication.
Okay.
In fact, sometimes, like, tummy fat and all, sometimes it might help them control the sugar better also. There are studies showing that also, but not that that should be done for that reason.
Okay.
But it is not a contraindication.
Madam, after the surgery, what are the post-operative care one must take?
Okay. Post-operative, first you should use all the medications given prescribed by your doctor.
Okay.
Second thing, hydration and nutrition are very important for healing. So you have to be well hydrated, because liposuction is removal of fluid also with the fat from your body.
Yes, yes.
So hydration is very important. Also, giving body good nutrition, good homemade food with adequate protein and vitamins, minerals, so that your body heals well.
Okay.
Apart from this, a compression garment that we discussed, they have to wear a compression garment 24/7 for the next 4 weeks.
4 weeks.
Yes.
After that, not
That again, once your doctor sees you and says it's okay enough, then you can stop wearing. But
Okay.
till the doctor sees, you have to wear.
Okay.
And another important thing that we already discussed once is the massages. Because massages will really help for the swelling to come down fast and the blood circulation to improve. So what we call it manual lymphatic massages. So massaging in the direction of the lymph node so that all that swelling goes and the recovery is faster.
Okay.
And mobility is also important. So even after surgery, moving around, strolling around in the house, just taking that much rest that body needs.
Okay.
Taking that afternoon little nap and then sleeping early in the night. Get up early, stroll around. You don't have to go out of the house, but yes, mobility is also very important for good recovery.
Any recommendation food intake?
Not really. We'd say, okay, initially first 4-5 days, because they'll be on pain medication and other antibiotics course that we give. We tell them to eat what is easily digestible and light on the stomach. But slowly later on, after 4-5 days, I recommend high protein diet with less carbohydrate and rich in vitamins and all that. Then we also introduce the vitamin supplements to help in healing.
And this is after how many days?
No, immediately
after
also
surgery.
they can have normal food.
Okay.
But during the medication time, it's always easier on the body to have light food so that the digestion is not affected.
Yes.
But they're encouraged to eat regular food.
Can liposuction be combined with other procedures?
Yes, we regularly combine liposuction with other body contouring procedures. So like something like, for example, let us talk about tummy tuck. When we do tummy tuck, that is removal of excess skin. If somebody has saggy lower belly or something, especially after pregnancies. So when we remove that, we do liposuction of the back and the upper abdomen to give that good shape. I hope you can understand that, to give a proper shape, it's not just removal. I need to lessen the fat in the area that we are not removing.
Yes, yes.
So for those kind of surgeries, we definitely do like a combined lipo and excisional procedures when we are dealing with especially tummy tucks and post massive weight loss procedures where we are removing excess skin. Some areas might need little liposuction also to give that contour, basically.
Okay. Madam, how do I choose the right surgeon for the liposuction?
Okay, so it's like this. Somebody who wants the liposuction, first and foremost, they should approach a plastic surgeon.
Okay.
Not anybody who calls themselves a cosmetic surgeon. Because, there's a lot of confusion between cosmetic surgery, plastic surgery, all that.
Yes, yes.
Ideally, cosmetic surgery is done by trained plastic surgeons, or rather, they give the best results, safe results.
Yes.
So, you should choose a plastic surgeon who, in their practice, do a lot of cosmetic surgery. Also, when you choose your surgeon, when you go to him or her, you should ask them to show their work. Because you'll only understand if they show their before-after results. You'll understand whether that surgeon will be able to give you the result that you are desiring to see.
Yes.
So that makes a difference. Their work you have to see and appreciate, and whether that is how you decide whether that person is the right surgeon for you. Okay. Unless you see, how would you know whether that surgeon can deliver or not? But the basic thing is that, yes, your surgeon has to be a plastic surgeon practicing cosmetic surgery.
Okay.
Also, it's not just the right surgeon. Where you are getting operated also is very important, and it's a very relevant thing that you have to consider.
Yes.
Because the safety of the surgery depends on the place where it is done also.
Yes.
So ideally, liposuction has to be done by, of course, a qualified plastic surgeon in an operation theater which follows all the norms of safety in a hospital facility. So it's not a surgery where you do in a clinic or some small place which is not a ideal operation theater.
Okay.
So that is very important. So these surgeries are meant to be done in a hospital facility only. If it has to be safe.
Yes.
I hope that answers the question.
Thank you, ma'am. Because you have answered so many questions that basic general people that don't know about.
Yes.
They have ignorant about all these things.
Yeah.
And through.
No, these are important because ultimately all of us need our patients to be safe. And yes, safety is the priority.
Yes.
Everything is next.
Safety the priority. And as I told my viewers so many times, we are making this video for your education purpose only. Once you get the proper knowledge, once you educate yourself properly, then only you can choose how to take care of your health. And our guests, those who are coming here, they are all doctors, and their advice are like that only, to help you and to think about your health and wellness. So
definitely, because we see a lot of people going to the wrong people, are in the wrong hands.
Yes.
And come with complications. And complications are not easy to manage. See, as surgeons, we do see complications to a certain extent, and because we are equipped already to handle them, we can handle them well. Because we anticipate if some patient has some problem, we do treat complications. But sometimes they come in such bad shapes with making the wrong choice of a surgeon or the place, or so that makes us feel really sad that people are unable to choose also.
Yes.
There's a lot of information out there. I don't know, with their own body, how people can take a risk of not choosing it right.
In medical field, ma'am, people goes with a trust.
Exactly. Yeah.
Like in my area, if I am a little bit educated or little bit well known, then if something is happening nearby, so they'll come to me and ask me. So whether I know or I don't know, but I'll recommend something like that. You go to this.
No, that's important to spread the knowledge.
Ma'am, as you told that liposuction will helpful for excessive removal of our stubborn body fat. So how does liposuction improve the overall shape of our body? Could you explain it? Yeah,
so we are targeting the stubborn fat and the excess fat, which is probably not supposed to be there. Yes. For example, like I was talking about, a lean person, women especially having very fat thighs.
Yes.
So once you reduce that, suddenly she'll be very proportionate. She'll have a very proportionate body. And arms. Yes. You have a slim body, your arms are fat. You remove it, it's done. For males, chest, everywhere they're fit except the chest area where it's bulging out. Remove it, they're back in shape. So definitely improves the overall, because when we target and remove the fat, we remove enough to make it proportionate. We don't remove all the fat.
Yes.
The point is to make the body proportionate.
Proportionate to give
that overall symmetry and all that.
Yes.
We correct asymmetries also. If they're different on different sides also, we make sure that they match.
You are shaping the body.
Yes. It's body contouring. That's why I said liposuction is for body contouring. It's not for weight loss.
Madam, after post-pregnancy, maximum Indian women have fat on the belly. On that case, can we go for liposuction?
Yes, Vishwa, we can. But let me explain that not everybody's body changes in a certain way only.
Okay.
And in fact, most of the times, what they have is loose skin because yes, the pregnancy stretches out the skin for 9 months, and after the delivery of the baby, some women who have good genetics and all that, the skin, muscles, everything come back to their normal position, and probably they will not need anything. Some people, one category of people, will have that little excess fat that they've put on during pregnancy, but loose skin won't be there. That's just a little bit of fat around the belly and love handle area. I think that's the way body adapts itself to pregnancy. gaining a little fat around that area to help with the, all that. But anyway, there is another good majority of patients who will be unable to shrink the skin and the lower belly especially on their own. So in those cases, you should understand just liposuction will not help. There we have to do an additional procedure called the tummy tuck or abdominoplasty along with liposuction. What the terminology we use is 360 degrees liposuction with the tummy tuck, where we are addressing the excess fat which is there on the back and the upper abdomen, and the lower abdomen which is excess skin. That too cannot go away with liposuction. So that we have to remove by excision and give them a proper tucked look so that the abdomen will look like the pre-pregnant state.
Yes.
Understood. But some people who do not have excess skin might find just liposuction helpful, will benefit from just liposuction, some of them.
But along with liposuction, if you go for tummy tuck, that would be...
Not for all. That's what I'm trying to explain to you. Somebody who has loose lower belly or loose abdominal wall which has not shrunk. Those people who have a lot of stretch marks and very loose skin, that will not go away with liposuction. No, we have to remove that skin. And the surgery for that is called the tummy tuck surgery.
And that tummy tuck surgery will be done at a certain age or at any time?
No, again, we can do it because not everybody comes immediately. When they have very little children, they'll need a lot of time and effort that goes into the kids. Some people come a little later also. People come in various age groups from 25 to 55 or little later also. Majority come in their 30s usually. But again, age is not like a factor that we consider. It's more about the health and their BMI and how sure I am that they'll take care of their post-op result, all that. And also with the small children, sometimes they should have the time to, take the time off from the kids to get the surgery done comfortably. Some people might not have help at home. That also we consider. We ask them. Suppose they don't have any help at home. How will, during the recovery, if sometimes the husbands do volunteer to help, that's a good thing. But all that also we take into consideration when we choose a patient to do the surgery.
What is the right time to go for tummy tuck surgery? After delivery or...
At least, I would say at least 1 year after pregnancy ends, because the child would be very small. They will need full-time attention of the mother. Also, the body is recovering. Nature also, you should give the nature time, body. When I say nature, your body time to recoup and do what best it can do for itself. Give the body time. Say 9 months to 1 year after delivery. And then and also one very important thing is preferably after you complete your family. Some people after one pregnancy will be very unhappy with their tummy and they come and ask me, Madam, can you do a tummy tuck? I say, are you planning another pregnancy? If you are, please wait. Finish it and then, because why put your body through all that thing? And obviously second pregnancy also might result in some amount of stretching out.
So it's recommendable for...
After completion of the family and 1 year after the last pregnancy. That's my recommendation.
Your recommendation is needed.
Yes.
How does liposuction help people to feel better about their appearances?
Yes, so we were talking, some areas of stubborn fat somewhere which is bothering them because they're not able to wear certain types of clothes. Suppose something is trendy and then unable to wear that kind of clothes because of that fat. Best example is fat thighs. If that woman wants to wear jeans or something and it's looking bad because of that fat there, it's fine to solve that issue by liposuction.
How do you help patients who wants liposuction for the beauty reasons?
Which is the same thing, actually. Beauty standards, I feel there are no standards of beauty. It's about how oneself sees him or her in the mirror and what they feel about their body. There is also something like body dysmorphism. That's totally a different thing. Maybe we can discuss some other time. But if the need is genuine and it is solvable, that aspect that is bothering them is safely solvable by liposuction surgery, then why not? We can do it and help them.
Yes, ma'am.
But it's not to meet some standards of beauty which are not there, It's all about the person, how they're perceiving themselves and what they think is bothering them.
Okay. Nowadays, girls,
Hmm.
girls or boys, they're more concerned about their appearances.
It's not wrong to be conscious about their appearance, according to me, because this is an era of social media and all that.
Yes.
That's okay. They want to look their best. But again, let me mention that we do get a lot of clients asking for so many things. But it again, I feel, when as a surgeon and as a person, when I see them, if somebody is asking for something which I think is not safe or which is going to disfigure them, because their standard of or definition of looks probably is different than what is normal.
Yes.
We are getting like, somebody wants a very big, butt, somebody wants a very narrow waist. These are some things that, as a surgeon, I have some ethical points where I would not, that's like a no compromise area.
Yes.
Probably I'm not the right surgeon for them. I will tell them. I would not encourage something which is going to physically harm them or which is not close to normalcy. If their thinking or expectation is not like that, that's a red flag for me. I would not operate on such a patient.
That's the ethicality.
Yeah.
Whatever.
So that's why I'm saying we turn down so many patients saying that they're not the right
proper
person
candidate
for
for surgery.
surgery.
So, ma'am, you are a doctor, you are a surgeon, and along with that, you are a woman and you are a mother also. So,
Yes.
how are you managing all this thing?
Let me tell you, for every working woman, family support is very important. I'm very lucky to have a family who's very supportive of the fact that I am busy and I do a lot of work. And even right from the time I set out to do super specialty plastic surgery, a lot of support system I had at home. That's the reason how I could do my further studies and become a plastic surgeon. When I had, like, my kids were really small, my parents and my in-laws, my husband, everybody said, go ahead, do it. And then that I totally attribute that part of my journey to my family, the help that I received from them. Even day to day, I'm lucky that I have family support helping me, because if I have to give my best and not be worried about what's happening at home, though I definitely give good portion of my time, because I believe in quality time than quantity. Whatever time I get, I do spend with my family. But again, having that support system is been a blessing for me and to help me do what I'm doing.
Every working woman, without support system of their family,
I totally
it's very
agree.
difficult to do.
Yes.
Ma'am, how do you manage the emotional demands in the profession?
This is a little difficult question to answer, but I can say this. See, every client who comes to us and who chooses to do surgery with me, for that brief period of time, from before surgery, while I'm counseling, during the surgery, after surgery, while they're recovering, they become a part of our lives,
Yes,
And I can say that, we as surgeons, I mean, at least I believe that, unless we go down to their emotional state and understand why they are choosing that surgery and why they sought, obviously they trusted me and come to me for their transformation. It is definitely an emotional thing for me to be with them through the whole journey, and they don't need my care anymore. It's very humbling, to have a patient believe and trust in me through their transformation journey.
Yes.
And it is disturbing also sometimes when somebody has a little complication. It could be small or big. It is an emotional experience, at least for me.
Yes.
Till my patient is happy and finally back on their own and happy with their result. It means a lot to me.
Yes.
For a patient, from the time I see them to be out of my care, a more confident self is a very, very big emotional challenge for me.
When you see a smile on the patient's face, I think
Exactly. It is, I cannot be measured with anything. It's
for a doctor, this is the most lovable thing.
Yes.
When the patient comes with a proper result and he or she has a smile on her face,
Especially, Vishwa, you should understand that these people, especially in plastic surgery, and because cosmetic surgery, we do a lot of reconstruction also. But in cosmetic surgery, we are dealing with normal people. They have come for some enhancement,
Yes.
to feel better, to look better. So, and with what courage that they would have taken out to come under the knife is so much, and that support and being there with them emotionally is very important for them to recover well. That's what I feel. So I feel quite connected to my patients, at least during the time they're under my care.
Yes. This is the most important part of a care.
Yes.
That's not about the
every
surgery.
every profession, when you have a client or a customer, you should be connected to them to understand their need and to deliver the best to them.
Yes. That's everyone should learn this one from you. What are the risks and complications in the liposuctions?
See, risk is minimal. Again, like I said, if you choose the right surgeon and the right hospital, everything risk is minimized to its bare minimum. And coming to complications, yes, we do see complications like seromas or some collections, occasionally bleeding, minor complications. I can't say they're all major. And if we take proper selection of the patient and all, there are minor complications, and we do deal with complications, and the journey doesn't end till we finish healing our patients.
Yes.
But there are no complications that you can't deal with, that we can't deal with, and we make sure the patient is healed even in spite of the complication if it has occurred also. But I should mention here that we see complications like skin necrosis, skin becoming very thin and dead if it is overdone, but which is not intentionally. Sometimes it can happen, but if it's a very small area, it heals well. But we see more of these complications coming from other surgeons who are not qualified or quacks. Some people, like I told you, land in wrong hands and then come back with complications of these procedures. That is a difficult part to handle, but we do take care of them also.
Let's come to basically the people's generally very eager to ask, eager to listen this thing. Before coming to the liposuction surgery, they have the questions in the mind that what is the cost of the surgery? How much does it cost for the liposuction? So
again, cost depends on what areas are treated, how much area we are covering. It depends on, just thighs would cost so much. Also, cost factor comes into what technology we are using. Because technology comes with a cost. See, some surgeon is just using liposuction, a suction machine, and doing a liposuction. And another surgeon has adopted technologies like power assisted liposuction or ultrasound assisted liposuction, which are expensive machines, and that surgeon has bought in the technology only to help the patient better. So there is no standardized costing. Some surgeon would probably say, let's talk about an example, a gynecomastia. Some surgeon might offer it for 50,000. The other surgeon would say 75,000 or 80,000. It's about the technology and the infrastructure that they have invested to give a better result for the patient. So it varies. It's not standardized. Depends on the skill of the patient, a very senior skill, because you understand, right? You were catering to your time and effort and skill. And another thing very important to note is all the cosmetic surgeries are GST payable. If somebody is practicing ethically and following all the rules of the government, all the cosmetic surgeries are payable at 18% GST. 18% GST? Yes. As a plastic surgeon, I have a GST number and I am supposed to be collecting an 18% GST on every cosmetic surgery that I do, which I follow. It's a great thing. Which is a government norm. Government norm, and I think this is the only one surgery. Yes, like pure cosmetic surgeries are GST payable. Unless it is done for any medical reasons. Or disfigurements or birth defects, which we also deal with all of those, or anything which happens, which is not in the normal form or structure, which we correct, we don't charge, but pure cosmetic procedure is GST payable. Yes. So nowadays people are coming from aware about their health, wealth, and appearance. So thank you. Today, just that, don't compromise on any of them. Choose the right doctor who can deliver the best and safe results for you. Yes. That is very important. Very important. So
today we came to know so many things about the liposuction surgeries and so many things in different topics. We had a discussion with Dr. Sunita Ghanta. So, as I told you earlier, also this podcast is only for to educate to our viewers, and you educate on you learn listen this podcast and go to a proper plastic surgeon if you want to go for plastic liposuction surgery, and follow their advice and make your health fit.
And be safe.
Be safe.
Be safe is important.
Be safe is important.
I'm really happy that I got this opportunity to educate you all. I hope this video helps you to gain the knowledge of about liposuction, and anybody, it could be you or your friends or family, whoever needs it. Please spread the word about liposuction, and make sure they choose the right surgeon and they are not going into making wrong decisions and
Yes.
going into the wrong hands and falling into trouble. So that's the whole purpose of this podcast, that they have made so much effort to make all these videos. So I hope that was really helpful. Thank you.
Ma'am. Thank you.
Thank you.